So during this video, I'll be covering chapter 12, flexibility, through lecture and PowerPoint that we covered in class, and also through the book. So, the definition I came up with stretching would be warming up your body to push it through the full range of motion. The way I also look at it is what happens to a cold rubber band. It'll typically snap when you try to pull it apart. If you warm up the rubber band, you can stretch it a lot further. Some factors that can limit the range of motion at a joint. One would be bony structure in the knee or elbow joints. Next would be the soft tissues, including muscle, connective tissue, and skin, usually in the ankle or hip joints. Now we will go into some video examples of different types of stretches. The first stretch is static stretching. This extends your muscles to the end of the range of motion, then holding it at that position for 15 to 20 seconds. So the example that you see are the overhead arm stretch. This stretching the tricep and the lat. Then you have the trunk rotation. Have your feet planted and your trunk twisting. This loosens up your hips, waist, and your core. Next, we'll go over ballistic stretching. This stretching is warming up using the momentum of moving your body in an attempt to force it beyond its normal range of motion by bouncing in or out of the stretch position. The example I show here is bouncing and trying to rapidly touch your toes. As you can see, bouncing in and out. Next, I'll be going over the PNF stretching. It is more advanced stretch, and it's for flexibility training that involves both the stretching and the contraction of the muscle group being targeted. So in this example, I'm really trying to stretch my hamstring using the band to help hold my leg while I'm trying to push against it. The next stretch I'm showing is the dynamic stretch that uses momentum and active muscular effort are used to stretch the muscle groups. An example that is showing is the lunge and twist, loosening up my hips, legs, and core muscles. Next, I will be showing my squat analysis, as you have to ask your patient to take off your shoes to get a proper reading. So during my analysis, from the anterior view, you can see my feet slant slightly in, not too much, but some overactive muscles that could be going on would be the soleus. And some strengthening exercises I could do would be single leg balance reach. When looking at my knees from that point of view, you can see my knees move ever so slightly outward, and some overactive muscles going on could be piriformis. Some examples of strengthening exercises would be ball squat adduction. Now looking from the lateral view, you can see that I have some excessive forward leaning, meaning I should be strengthening by squatting with a ball overhead. Then looking at my lower back, you can see that it arches, and it could mean that my hip flexor complex could be in overuse, or my erector spinae could also be overactive muscle. Something I should consider is some floor bridges and to strengthen my lower back. And yes, You can see from this point of view, as well as the last one, my arms fall forward, but not too much, I would say. But if they did, I would be considering my latissimus dorsi and see if there is some overactiveness going on. And some strengthening exercises I could do would be floor cobras. Now looking at the posterior view, you can see my feet flattening, and some probable muscle overacting would be peroneal, and some exercises to strengthen that would be single leg balance reach, and my heel does raise, so that would be that I would have to work on my soleus and some stretches I could do in soleus stretch. Then I would say my asymmetric weight shift is pretty even, and I couldn't spot anything too much. As you can see throughout the video, that my squat isn't as bad, but still pretty tight and have to work on some things.